Taking care of our health is important. Our genes might predetermine our health, but there are ways to take care of yourself. Today's sponsor, Two Roads Wellness, Sasha Powell, joins me. Sasha, I'm glad to have you here in studio with us.
Thank you.
Yes, okay. Well, I know Two Roads Wellness kind of covers a gamut of services that they offer to the community. Today we're talking about kind of what role your genes play in your health. Can you kind of break down the role that genetics have?
Yeah, so we are all born with a very specific set of genes that make us very individual. So when we talk about trying to develop health and wellness programs for people, we want this to be very specific for each individual person. So your genetic predisposition may be much different than mine for lots of different disease processes and even wellness functions, what vitamins and minerals your body needs. If you have a genetic predisposition to heart disease, then we need to focus more on that. Maybe for you, where maybe I have more predisposition for thyroid disease, then I need to focus on those things to help my wellness journey a little bit differently than yours.
So how does knowing these things influence your course of action in terms of caring for yourself or for health in general?
So when we can look at your genetic predisposition, we can tell you which particular vitamins and minerals you may need and what foods those might come from. We can focus labs that maybe you need to have assessed more frequently or more often based on that predisposition. We'll know if you already have the actual diagnosis associated with that predisposition, if we need to work even harder on diet and exercise and very specific supplementation recommendations that might be better impactful to help medications that you might already be on from your primary care provider. We like to do the whole person approach. So we're not just talking about medication, but what other lifestyle modifications would be specific for you based on your genes.
Which I love, because I feel like when you give someone a lifestyle approach, it feels like they have control and autonomy over the course of action more than, okay, you're prescribing me something to take or recommending something that I take, which is like, I hope this helps, but what else can I do? And those lifestyle things really do help, like you have some power. At what point in someone's life should they start considering learning about what their kind of dispositions are?
In my opinion, I think the earlier the better.
Okay.
While you're well and you're young and you're able to actually see this could be something that may be a problem for me. I know my dad has it and my grandparents have it. If you can actually know that predisposition and we can do something about it early on, we can maybe stave that off so it never becomes a problem for you because you'll know that it actually exists and that you can and should do something about it.
So those preventative measures. So if something is in kind of your genetics, is there a way, if you focus on those lifestyle changes in order to kind of take those preventative measures and maybe you don't end up with what the past 3 generations of your family have had, can you change it for future generations?
Not exactly,
okay.
But by learning those behaviors early on for your children, if you've changed the way that you function and you eat and the way that you live, then your children and future generations may make that a normal part of their lives. And then, yes, it could change their outcomes as well.
Okay, talk about what Two Roads Wellness does in order to learn about an individual's predispositions or what they can do to move forward to live their healthiest life.
So it can be a couple of different ways. If you've already done a genetic test, like with Ancestry or 23andMe, MyHeritage, I can actually take that raw data and upload it into the program that I use. Or Self Decode actually has their own kits that are available to use as well. I can just take any of that raw data, upload it into the program, and then produce the reports that provide the recommendations, your risk scores, your predispositions, and I follow up with the patients to go over all of that information so that I can guide you as a practitioner so it's not so confusing and overwhelming, but make it very, very specific for you, because what you need to do is going to be very different than maybe what your partner in the house does or your best friend does. Everyone has to have their own specific plan.
Such an individualized experience, obviously a very unique thing that Two Roads Wellness can offer. How can they get in touch and kind of schedule maybe that first appointment to talk this all through of what this could look like?
So you can call any of the 4 locations, or you can send us a message. Probably one of of the most efficient ways to get a hold of us is to send the message to contact@tworoadswellnessclinic.com.
Okay, and you guys have tons of locations to make it convenient for everybody. I know that the Danville office sounds like they're making a move to a cool location as well, a bigger one. We will connect everyone to find the location that works best for them. There is a look at some of those right there of the numbers that you can call. We'll also connect you to over on our website, CILiving.tv. And we appreciate Two Roads Wellness for sponsoring today's segment.